And it's a 12 minutes past 7 morning. So a major report has found that people with dementia who've been admitted to hospital with other acute conditions are being failed by the care they're getting.
The BBC's 5 Live Investigates programme has seen an NHS report which says the care provided on hospital wards isn't geared towards those with dementia. Well, joining us now is Dr. Katie Featherstone, who wrote the report, and Jackie Askey, whose husband had dementia. Good morning to you both.
Morning. Good morning.
Thanks for coming in. To you first, Dr. Featherstone. The challenge here, it seems, is that more and more people in hospital have got dementia, as well as perhaps some other condition that has led to them being hospitalised, and yet there doesn't seem to be enough awareness of that.
Absolutely. It's really interesting that people living with dementia with an additional acute condition are one of the biggest populations in our acute wards. 25 to 50% of patients in all our hospitals have dementia, but another condition. So it might be an infection or a fracture. So they need to be there. But they're also one of the populations that are the most invisible, incredibly invisible. And what we need to do is really challenge that. So really, I think one of the key things what we found was that wards are structured around the wrong population. They're structured around an average working age person who's fully cognitively aware and can fit into the routines of the ward. But what we find is that people live with dementia are also expected to fit into those structured routines. And for that sensitive population, that sensitive group, they just can't do that. They just don't have the skills. They don't have time to express themselves. And it's really difficult for them to fit into those very tight ward structures and ward routines. And it's also really bad for nurses and healthcare assistants as well. They're also really struggling.
Jackie, tell me about your experience with your husband, George.
Well, my husband was admitted to hospital with a virus, and he was rehydrated. I took him to hospital because he wouldn't drink anything. They rehydrated him and kept him in. And then gradually the virus was coming and going, which was the same for everyone at that time of year. And he got to the stage where he couldn't eat and drink. And they were saying, oh, he's got end-stage dementia. And I said, no, he hasn't got end-stage dementia. He's got a virus, and there's something wrong with his taste buds. And they would not listen. A doctor said he's got end-stage dementia, and that went with him we moved on to another ward. I found him almost unconscious because they weren't keeping him hydrated. And this diagnosis of end-stage dementia came excuse me, the same day as the phlebotomist had been round and asked him his name, date of birth, address, and he gave the postcode as well. And then they say he's got end-stage dementia because he wasn't eating and drinking. 10 days later, I found oral thrush, and that's why he hadn't been eating and drinking, because it was very painful, and he had all this horrible lemon stuff in his mouth that I thought was the 40 creme they were giving him to try and get him to eat. And with dementia, of course, it was difficult to put a peg in, so there was no way to get him to eat.
And that's ultimately what you believe killed him. Kate, we keep being told that the government is investing all kinds of money in dementia care. They say that they've invested £50 million to make hospitals and care homes more dementia-friendly. 875,000 NHS staff have undertaken awareness-raising activities. We're supporting trusts to sign up to Dementia Action Alliance's Dementia-Friendly Hospital Charter. So the intention is there, but what you're saying is that that's not in evidence on the wards yet.
No, it's not. And it's not supporting people who live with dementia, but also it's not supporting the ward staff who are really struggling. And I think one of the things that we feel really strongly about is, rather than this kind of reactive approach of the NHS, Department of Health and hospital trusts, of being reactive and putting small interventions in place, they really need to have a wholesale culture change and really recognise that this is now their main population. So everything they do really has to be geared around that group. We can fit into the schedule for them, but they really need a schedule that works for them, that care is all delivered to support them.
Jackie, you've campaigned ever since George's death to try and improve things for dementia patients in hospital. Are you seeing any evidence of improvement?
Not a great deal, to be honest. You know, talking to friends who've had people go into hospital, I'm still getting very mixed feedback from them, to them just being ignored, no one's talking to them. It may be because staff haven't got time, but I think also it's part of the fact that they're not able to go and do the dementia training, because I've been on the Cardiff Dementia Task Force, and we advocated that all staff, all frontline staff, that's from the porter to the doctor, should have dementia training, and they're not all going. Partly because they can't all be released, because there's not enough staff to cover them. And I've also been involved in a campaign with, it was competition actually, and it was to improve the lot for people with dementia in hospitals.
Amazing work you've been doing, actually, Jackie. Thank you very much for your time this morning, and Kate as well. Thank you for coming in and talking to us about it.
Thank you.
Thank you so much.
Thank you.